Therapy. Are you thinking about going into it? Well, there's a couple questions you want to ask your therapist that are very, very important. And you have to decide how they answer these if you're going to continue with them. But I want you to pay attention to that. Last thing I just said, continue with them. You should be, and you are allowed to shop for us. We don't fit for everybody, just like you don't fit for everybody. So you want to make sure it's a fit. Okay, so question number one. What is your theoretical orientation? A theoretical orientation is a perspective of how we look at things in big picture, like how do we look at the world? A couple examples would be systems theory, family theory, or existentialism. Existentialism is mine. I follow a guy, Viktor Frankl. I can get into that later. You want to know what this is because that tells you the path and the trajectory that you're going to go on with the therapist, knowing that they have a start point and an end point. The second question that you want to ask is, how did you or why did you become a therapist? There should be, not to be corny or overly egotistical, but there should be like an origin story of why and how and what drove you. You know, for me, this is what pulls me and drives me through life. This is my passion. This is my purpose. I do this shit 7 days a week. Most of the time I do. You want that. You want to feel the drive with the person. Final question. How do we know when I am done with therapy? That should be in the beginning of therapy, like in the intake, the first couple sessions. How do we know when we're done, and what does that look like? You really want to make sure you ask these questions very specifically, and I want to go back to the theoretical orientation one. That one's extremely important because think of it this way. If you meet somebody and they say, oh, what do you do? And you give the answer of, I'm in construction. Okay, right, I'm a therapist. I'm in construction. Well, what type of construction do you do? And they give you the answer of hammer. That makes no sense. They should answer carpenter, plumber, HVAC technician, electrician, the general contractor, whatever it is, but they should be able to answer very, very specifically. That's what your theoretical orientation is. If somebody says, oh, I do CBT, DBT, ACT, EFT, or I do what fits the client or the patient, you want to run from that because that means that they are all over the place. DBT, CBT, EFT, AFT, ACT. You might not know what all these are, but these are different modalities that we use in therapy. Those are tools. Those are the hammer, the screwdriver, the drill, the saw, all of that, right? The theoretical orientation is whether you're a carpenter or plumber. So, theoretical orientation. If they give you the answer of using a tool, that doesn't make any sense. So please, ask your therapist these questions. These are very, very important. Good luck.